Medical disclaimer. The information provided in this video is for educational purposes only and is not intended as medical advice. Always consult a qualified healthcare professional before making any health-related decisions. MedPages does not diagnose, treat, or cure any medical condition. Chapter 2. The Delicate Dance of Reproductive Health. Elena was 32, a dance instructor in Miami, when she first felt the weight of what she thought was just stress. Her energy lagged, and she noticed subtle changes in her cycle, but she attributed it to long hours on her feet. She didn't yet know that her reproductive system, a marvel of biological choreography, was at risk of disruption by pelvic inflammatory disease. Before we can understand how PID wreaks havoc, we must first appreciate the intricate dance of a healthy female reproductive system, a system Elena took for granted until it faltered. Picture the reproductive system as a beautifully orchestrated ballet. The ovaries are the lead dancers, producing eggs each month with precise timing, twirling them down the fallopian tubes toward the uterus, the grand stage where life can begin. The uterus itself is a muscular theater, lined with a plush endometrial curtain that thickens and sheds in a monthly rhythm, preparing for a potential pregnancy. Surrounding this stage are supporting players, the cervix, acting as a gatekeeper, and the vagina, a pathway connecting the internal world to the external. Hormones like estrogen and progesterone are the conductors, ensuring every movement happens in perfect sync. This ballet is not just about reproduction, it's about balance, influencing mood, bone health, and even heart function. Imagine the ovaries as glowing orbs, releasing their eggs like delicate pearls, gliding through the fallopian tube's feathery fronds toward a waiting, velvet-lined womb. In a healthy state, this system is protected by natural defenses. The cervix produces mucus, a sticky barrier that traps harmful bacteria before they can ascend into the upper reproductive tract. Immune cells patrol the area, ready to neutralize invaders. It's like a castle with moats and guards, designed to keep out threats. But this fortress isn't impenetrable. Certain factors, unprotected sex, multiple partners, or even medical procedures like IUD insertion can lower the drawbridge, allowing bacteria to slip through. Globally, the female reproductive system operates in billions of women with remarkable consistency, yet its health is often overlooked until something goes wrong. According to the World Health Organization, reproductive health issues, including infections, account for a significant portion of global disease burden among women, with millions affected by conditions that could have been prevented with proper education and care. This system, so vital to life and identity, deserves our attention even when it's functioning silently in the background. For Elena, understanding this delicate dance came too late. If she had known how her body worked, she might have noticed the early warning signs of infection sooner. So, what can we learn from this? First, take time to know your body. Track your cycles, note changes in pain or discharge, and don't dismiss subtle shifts as mere stress. Second, protect your castle, practice safe sex, maintain regular checkups, and be mindful of procedures that might introduce risk. And finally, honor this system's complexity. It's not just about reproduction, it's about your overall well-being. I spoke with Dr. Aisha Khan, a reproductive endocrinologist, who likened the female reproductive system to a symphony. Every part has a role, she said, and when even one instrument is out of tune, the whole performance suffers. We need to listen closely to keep the music playing. As we move forward, let's hold this image of a harmonious ballet or symphony in mind. It's a reminder of what's at stake when pelvic inflammatory disease enters the stage, turning grace into chaos. Let's explore that disruption next, understanding how this silent disease transforms a masterpiece into a battleground. Chapter 3. The Invasion Within. Sophia was only 19, a college freshman in Seattle, when she felt the first sharp twinge in her pelvis. It wasn't just cramps, it was a deep, gnawing pain that made her double over during a lecture. She thought it would pass, but it didn't. What Sophia didn't know was that her body was under attack by pelvic inflammatory disease, a condition where infection creeps into the reproductive organs, turning a sanctuary into a war zone. To understand PID, we need to dive into what happens at the cellular and molecular level when this silent invader strikes. Imagine the female reproductive tract as a serene garden, with the uterus, fallopian tubes, and ovaries as lush, blooming flowers. Normally, this garden is guarded by barriers like cervical mucus and immune cells, keeping out harmful weeds. But when bacteria, often from sexually transmitted infections like chlamydia trachomatis or Neisseria gonorrhoeae, breach these defenses, they act like invasive vines. These pathogens sneak past the cervix, climbing into the upper reproductive tract. Once inside, they trigger inflammation, the body's desperate attempt to fight back. Picture the once peaceful garden now ablaze with redness and swelling as immune cells rush in, releasing chemicals called cytokines that sound the alarm. This inflammation, while meant to protect, becomes a double-edged sword. At the cellular level, the bacteria attach to the delicate epithelial cells lining the fallopian tubes and uterus. Visualize these cells as soft, velvety petals, now being torn apart as bacteria multiply, forming sticky biofilms that resist immune attacks. The fallopian tubes, normally slender pathways for eggs, become swollen and scarred, their inner walls fusing together like melted wax. This scarring can block the tubes, preventing eggs from reaching the uterus, a primary cause of infertility in PID cases. Meanwhile, pus, a mix of dead cells and bacteria, pools in the area, creating abscesses that look like festering blisters under a microscope. These abscesses can rupture, spilling infection into the abdominal cavity, a life-threatening complication. On a molecular scale, the immune response spirals out of control. Cytokines overreact, damaging healthy tissue alongside the invaders. Think of this as a wildfire, meant to clear out pests, but burning everything in its path. The body's attempt to heal often results in fibrous scar tissue, which distorts the anatomy of the reproductive organs. For Sophia, this meant chronic pain as nerves became trapped in scar tissue, sending constant distress signals to her brain. Globally, PID's destructive pathology affects millions. The World Health Organization notes that untreated PID leads to infertility in up to 20% of cases, with higher rates in regions lacking access to early treatment. In the United States, the CDC reports that 10 to 15% of women with untreated chlamydia infections develop PID, a staggering figure given chlamydia's prevalence. So, what can we take away from this cellular battlefield? First, early intervention is critical. If Sophia had sought care at the first sign of pain, antibiotics might have stopped the invasion before scarring set in. Second, prevention matters. Safe sex and regular screenings can keep those invasive vines at bay. And finally, understand that PID isn't just a temporary infection. It's a condition with lasting consequences if ignored. I spoke with Dr. Maya Patel, an infectious disease specialist, who described PID's pathology vividly. It's like a hostile takeover. Bacteria hijack the reproductive tract, and the body's defense becomes its own enemy. We have to act fast to save what's left of the garden. Hold this image of a burning, scarred landscape in your mind as we move forward. It's a stark reminder of why recognizing symptoms early, before the wildfire spreads, is so vital. Let's explore those signs next, piecing together the puzzle of PID's progression. Chapter 4. The Warning Signs and Stages. Amina was 27, a graphic designer in Atlanta, when she first noticed something wasn't right. It started with a mild ache in her lower abdomen, something she chalked up to a tough workout. But over weeks, the pain intensified, paired with an unusual discharge and a low-grade fever that sapped her energy. Amina didn't realize she was in the early stages of pelvic inflammatory disease, a condition that unfolds in distinct phases, each with its own set of symptoms and challenges. Let's walk through the warning signs and stages of PID, helping you distinguish them from normal bodily changes and understand how they vary from person to person. In the early stage, PID often masquerades as something benign. The symptoms can be subtle: mild pelvic pain, perhaps a bit more intense than typical menstrual cramps, or an unusual vaginal discharge that might be yellowish or greenish, hinting at infection. Some women, like Amina, experience a slight fever or fatigue, easily mistaken for a passing bug. At this point, it's hard to separate PID from normal aging or stress-related aches. Picture a faint warning light on a car dashboard, blinking softly at first, easy to ignore. But this is the critical window for intervention. If caught now, antibiotics can often halt the disease before permanent damage occurs. As PID progresses to the moderate stage, the symptoms become harder to dismiss. The pelvic pain sharpens, often described as a constant, deep ache or a stabbing sensation during movement or intercourse. Fever may spike, and nausea or vomiting can set in as the body struggles with systemic inflammation. Imagine that dashboard light now flashing red, accompanied by an urgent beeping. The infection has likely spread deeper into the fallopian tubes and uterus, causing swelling and scarring. For Amina, this stage meant missing work, unable to focus through the pain. Yet, even now, treatment can mitigate long-term effects if started promptly. In the severe stage, PID becomes a full-blown crisis. The pain can be excruciating, radiating to the back or legs as abscesses form in the reproductive organs. Fever soars and chills rack the body, signaling a systemic infection. Complications like ectopic pregnancy or peritonitis, a life-threatening inflammation of the abdominal lining, loom large. Visualize the car now stalled on the roadside, smoke billowing from the hood. At this point, hospitalization is often necessary, and the risk of infertility or chronic pain skyrockets. Some women may face emergency surgery to drain abscesses or remove damaged tissue. Individual differences play a huge role in how PID manifests. Younger women might experience more acute symptoms due to robust immune responses, while older women or those with underlying conditions might have muted signs, delaying diagnosis. Cultural factors, like stigma around discussing reproductive health, can also influence when and if a woman seeks help. According to the CDC, about 1 in 8 women with a history of PID struggle with fertility issues, but outcomes vary widely based on timing of treatment and personal health factors. What can we learn from Amina's journey through these stages? First, don't ignore subtle changes. Mild pain or unusual discharge isn't always normal. Second, act quickly. If symptoms escalate to fever or severe pain, seek medical attention immediately. Don't wait for the dashboard to explode. And finally, know that everyone's experience is unique. Trust your body's signals, even if they don't match a textbook description. I spoke with Dr. Lila Chen, a women's health expert, who emphasized this variability. PID doesn't read a script. One woman might barely notice it, while another is bedridden. Listen to your body. It's trying to tell you something. Keep this in mind as we move to diagnosis, exploring how doctors confirm PID and distinguish it from other conditions. The journey from warning light to roadside breakdown doesn't have to be inevitable. Chapter 5. Detecting the Hidden Enemy. Rachel was 25, a barista in Denver, when she finally went to the doctor after months of nagging pelvic pain and irregular bleeding. She delayed seeking help, fearing it was nothing serious, but the discomfort became unbearable. Sitting in the sterile exam room, she felt a mix of dread and hope as her physician began the process of diagnosing pelvic inflammatory disease. Detecting PID isn't always straightforward. It's like hunting for a shadow in a dimly lit room. But modern tools and techniques can illuminate the problem if you know where to look. The diagnostic journey often starts with a detailed history and physical exam. doctors ask about symptoms, pain, discharge, fever, and sexual history, since PID is frequently linked to sexually transmitted infections like chlamydia or gonorrhea. Imagine a detective piecing together clues from a witness statement, trying to map out when and how the intruder entered. During the exam, a physician may perform a pelvic check, feeling for tenderness in the uterus or fallopian tubes. For Rachel, this was uncomfortable, a sharp reminder of her pain, but it's a critical first step. Tenderness or swelling can point to inflammation, though it's not definitive on its own. Lab tests are the next piece of the puzzle. Swabs from the cervix or vagina are taken to test for chlamydia and gonorrhea, the usual culprits behind PID. Blood tests might reveal elevated white blood cell counts, a sign of infection, or markers of inflammation like C-reactive protein. Picture these tests as magnifying glasses, zooming in on microscopic evidence of an invader. Urine tests can also rule out other causes like urinary tract infections. According to the CDC, lab confirmation of an STI strengthens a PID diagnosis, though negative results don't rule it out. Bacteria can hide or be missed. Imaging technologies add another layer of insight. Ultrasound, often transvaginal, can visualize the reproductive organs, revealing swollen fallopian tubes or fluid-filled abscesses. Think of this as a sonar scan, mapping out underwater hazards invisible to the naked eye. In more complex cases, an MRI or CT scan might be used to spot deeper inflammation or complications. Rachel's ultrasound showed thickened tubes, a key clue that confirmed her doctor's suspicions. These images aren't just diagnostic tools, they're windows into the silent damage unfolding inside. Biomarkers are an emerging frontier in PID diagnosis. Researchers are exploring specific proteins or genetic signatures in blood or tissue that could signal early inflammation, potentially catching PID before symptoms escalate. Imagine a smoke detector sensing fire before flames are visible. Future tests might work this way, offering non-invasive options. While not yet standard, studies published in journals like The Lancet suggest these could revolutionize early detection within the next decade. Globally, access to these diagnostic tools varies. The World Health Organization notes that in low-resource settings, PID is often diagnosed based on symptoms alone, leading to over- or undertreatment. In contrast, high-income countries rely on a combination of clinical and lab findings, though even there, delays in diagnosis are common due to stigma or lack of awareness. What can you take away from Rachel's diagnostic journey? First, don't delay seeking care. Early clues from a physical exam or swab can make all the difference. Second, ask about imaging if symptoms persist. Seeing the damage can guide treatment. And finally, advocate for yourself. If tests come back inconclusive but pain lingers, push for further investigation. I spoke with Dr. Nadia Ahmed, a diagnostic specialist, who said, PID is a master of disguise. We often have to layer tests to unmask it, but persistence pays off. Keep this detective mindset as we move to the next step, what to do immediately after a diagnosis is confirmed. Chapter 6. First Steps After Diagnosis. Clara was 29, a schoolteacher in Houston, when she received the news. Sitting in her doctor's office, surrounded by pastel walls and a humming air conditioner, she heard the words, pelvic inflammatory disease, and felt the world tilt. Her mind raced with questions. What now? Who do I tell? How do I manage this? A diagnosis of PID can be overwhelming, but knowing the immediate steps to take can anchor you in the storm. Let's walk through the practical and emotional first moves after hearing those life-altering words. The moment you're diagnosed, time becomes your ally. Start treatment as soon as possible, typically with a course of antibiotics prescribed by your doctor to target the infection. Clara was given a combination of pills to take over 2 weeks, and her physician stressed the importance of completing the full dose, even if symptoms eased sooner. Think of this as extinguishing a fire. You can't stop halfway just because the flames seem smaller. Delaying or skipping treatment risks worsening damage to your reproductive organs. Next, identify your medical team. Your primary point of contact might be your general practitioner or gynecologist, but don't hesitate to ask for a referral to an infectious disease specialist if complications arise. Clara's doctor connected her with a gynecologist who specialized in PID, someone who could monitor her long-term. Reach out to these experts quickly. Schedule follow-up appointments within a week to track progress. Picture assembling a crew for a rescue mission. Each member has a role, and coordination is key. If you're unsure who to call first, start with your diagnosing physician. They can guide you to the right specialists. Organizing your medical team also means preparing key questions. Ask your doctor, what caused my PID? And should my partner be tested or treated? What are the risks of infertility or chronic pain, and how can we minimize them? Are there side effects to my medication I should watch for? Clara wrote these down in a notebook, her hands shaky but determined. Having these answers helps you regain a sense of control. It's like mapping a treacherous path before taking the first step. Knowledge lights the way. Emotionally, a diagnosis can hit hard. Allow yourself to feel the fear, anger, or sadness, but don't isolate yourself. Tell a trusted friend or family member. Clara confided in her sister, who became her rock. Consider joining a support group, even online, to connect with others who understand. Picture this as finding a safe harbor in a storm. Shared stories can ease the burden. For family members, be honest about what you need, whether it's help with daily tasks or just a listening ear. Not all decisions are urgent. Starting antibiotics and notifying sexual partners to prevent reinfection are immediate priorities, but choices like fertility planning or surgical options can often wait until the acute infection subsides. Clara learned to pace herself, focusing on healing first. Discuss timelines with your doctor to distinguish what's pressing from what's future-focused. Globally, the CDC estimates that timely treatment reduces PID complications by over 50%, yet many women delay care due to stigma or access issues. Don't let hesitation steal your chance at recovery. Takeaway lessons from Clara's story are clear. Act fast on treatment, build your support network, and ask questions without shame. I spoke with Dr. Sofia Mendez, a women's health advocate, who said, "A diagnosis isn't the end. It's the start of fighting back. Equip yourself with the right team and information." Hold this mindset as we move into living with PID, exploring how to navigate daily life after the initial shock. Chapter 7. Living with the Shadow of PID. Tanya was 31, a marketing assistant in Boston, when pelvic inflammatory disease became a permanent part of her life. Even after antibiotics cleared the acute infection, she faced lingering pain that flared during long workdays, and the fear of infertility haunted her dreams of starting a family. Living with PID isn't just about managing a medical condition. It's about adapting to a new reality, one that affects body, mind, and relationships. Let's explore the daily challenges, coping strategies, and emotional landscape of life with this silent disease. For many women like Tanya, chronic pelvic pain becomes a constant companion. It's not just a physical ache, it's a reminder of what's been lost or what might be at risk. Tanya described it as a tight knot in her lower abdomen, worsening with stress or prolonged sitting. Daily life adaptations are essential. Using heating pads, practicing gentle stretches, or adjusting workstations for comfort can help. Imagine recalibrating your routine as if tuning a delicate instrument, finding small ways to ease the strain. Some women find relief in mindfulness or yoga, focusing on breath to manage pain spikes. Caregivers, often partners or family, bear a heavy burden too. Tanya's husband, Mark, struggled with helplessness as he watched her wince through daily tasks. Caregiver fatigue is real. Balancing support with personal needs can lead to burnout. Open communication is key. Mark learned to ask, "What do you need today?" rather than assuming. Picture this as a dance of give and take, where both partners adjust their steps to stay in rhythm. Caregivers should also seek their own support, whether through counseling or respite care, to recharge. Mental health takes a significant hit with PID. The uncertainty, will I ever be pain-free? Can I have children? Can spiral into anxiety or depression. Tanya found herself withdrawing, avoiding social events out of embarrassment over her condition. Therapy, whether individual or group, can be a lifeline. Cognitive behavioral techniques help reframe negative thoughts, while support groups offer solidarity. Think of this as rebuilding a shattered mirror, piece by piece, until you see yourself clearly again. Globally, studies in the Journal of Women's Health show that up to 30% of women with chronic PID symptoms report significant psychological distress, underscoring the need for mental health resources. Ethical dilemmas also surface. Should Tanya disclose her condition to future partners if dating again? How do you weigh the desire for pregnancy against the risks of ectopic pregnancy or complications? These are deeply personal choices, often navigated with a doctor's or counselor's guidance. Imagine standing at a crossroads, each path lined with unknowns, requiring courage to choose. Patient voices like Tanya's reveal resilience amid struggle. She started journaling to process her emotions, finding strength in small victories, days with less pain, moments of hope. Coping strategies vary. Some women lean on faith, others on creative outlets like art or writing. The key is finding what anchors you. According to the CDC, chronic PID affects quality of life for thousands annually in the US alone, yet many adapt with the right tools and support. Takeaways from Tanya's story include prioritizing self-care. Don't push through pain at the cost of your health. Seek mental health support early. It's not a sign of weakness, but of strength. And communicate with loved ones. Let them in on your journey. I spoke with Dr. Emily Wong, a psychologist specializing in chronic illness, who said, "PID changes lives, but it doesn't define them. Build a toolkit of coping mechanisms, and don't face it alone." Let's carry this wisdom forward as we explore resources and support systems to ease the burden of living with PID pain. Chapter 8: Finding Support in the Storm. Lydia was 28, a nurse in Phoenix, when pelvic inflammatory disease turned her world upside down. The diagnosis left her feeling isolated, grappling with pain and the fear of what lay ahead. But one day, while scrolling online late at night, she stumbled upon a forum where other women shared their PID stories. For the first time, she didn't feel so alone. Finding support, whether through organizations, communities, or reliable information, is a lifeline for those navigating this silent disease. Let's explore the resources available to help patients like Lydia, as well as caregivers, find their footing. The journey to support often starts with patient organizations. Groups like the Pelvic Inflammatory Disease Foundation, though not as widely known as others, offer educational materials and connect women with shared experiences. Imagine these organizations as lighthouses, guiding ships through foggy waters with information on treatment options and coping tips. In the United States, the CDC's website also provides fact sheets and links to local health services, a starting point for understanding PID's scope and management. Hotlines and helplines are another vital resource. The National Women's Health Network offers confidential phone support, where you can ask questions about symptoms or treatment without judgment. Picture this as a warm voice on the other end of the line, ready to listen when you're too overwhelmed to know where to turn. For urgent medical concerns, services like 211 in the US can connect you to local clinics or emergency care, ensuring you're not left stranded in a crisis. Online communities have become a haven for many, Forums on platforms like Reddit or dedicated websites like Health Unlocked host PID-specific groups where women share advice, vent frustrations, and celebrate small wins. Lydia found solace in reading posts from others who understood her chronic pain, even exchanging messages with a woman halfway across the country. Think of these spaces as virtual campfires, where strangers gather to warm themselves with shared stories. Be cautious, though. Verify advice with medical professionals, as not all online information is accurate. Financial assistance programs can ease the economic strain of PID treatment, especially for those facing chronic care costs. In the US, programs like Medicaid or nonprofit grants through organizations like the Patient Advocate Foundation help cover medical bills or medication expenses. Visualize this as a safety net, catching you when the financial ground feels shaky. Check eligibility through state health departments or hospital social workers who often know of local aid options. Caregiver support groups are equally important. Caring for someone with PID can be draining, and groups through organizations like the Family Caregiver Alliance offer workshops or online chats to address burnout. Lydia's partner joined a virtual meetup, learning how to balance support with self-care. Imagine this as a toolbox, equipping caregivers with strategies to stay strong for their loved ones. Navigating the healthcare system itself can feel like a maze. Start by requesting a case manager at your hospital or clinic, someone to coordinate appointments and insurance claims. Keep a binder of medical records, test results, and doctor notes. Lydia found this invaluable when seeing new specialists. Reliable information sources, like peer-reviewed journals accessible through PubMed or trusted sites like Mayo Clinic, help separate fact from fiction. Globally, the World Health Organization provides guidelines on PID management, especially useful in regions with limited local resources. Takeaways from Lydia's experience are clear. Seek out community, whether online or in person, to combat isolation. Tap into financial and medical resources to lighten the load, and always verify information. Trust science over hearsay. I spoke with Dr. Rachel Kim, a women's health coordinator, who said, "Support isn't a luxury, it's a necessity. PID patients need a network to thrive, not just survive." Let's carry this sense of connection forward as we explore current treatments for PID, building on the foundation of support. Chapter 9. Fighting Back with Treatment. Naomi was 26, a retail manager in Detroit, when she sat in her doctor's office, clutching a prescription for antibiotics. Diagnosed with pelvic inflammatory disease, she felt a flicker of hope, knowing there were ways to fight back, even if the road ahead looked daunting. Treating PID is about more than just clearing an infection. It's about halting damage and restoring quality of life. Let's delve into the current treatments, medications, non-pharmacological approaches, and multidisciplinary care that help women like Naomi reclaim their health. The cornerstone of PID treatment is antibiotics, designed to target the bacteria fueling the infection. Most cases are treated with a combination of drugs, like doxycycline and ceftriaxone, to cover common culprits such as chlamydia and gonorrhea. Imagine these medications as precision-guided missiles, seeking out and destroying bacterial invaders in the reproductive tract. They work by disrupting bacterial cell walls or protein synthesis, stopping multiplication in its tracks. Naomi took her pills twice daily for 2 weeks, a regimen that required strict adherence to prevent resistance or recurrence. According to the CDC, outpatient antibiotic treatment is effective for mild to moderate PID in over 90% of cases, though severe cases may require intravenous drugs in a hospital setting. Pain management often accompanies antibiotics. Over-the-counter options like ibuprofen reduce inflammation and ease pelvic discomfort, acting like a soothing balm on a raw wound. For Naomi, this was a game changer, allowing her to move through her day with less agony. In more intense cases, prescription pain relievers, or even nerve blocks might be used under medical supervision. Picture this as turning down the volume on a blaring alarm, giving the body space to heal. Non-pharmacological approaches play a vital role too. Physical therapy, particularly pelvic floor therapy, can address chronic pain by strengthening muscles and releasing tension. Naomi attended sessions where a therapist guided her through gentle exercises, likening it to untangling a knotted rope. Heat therapy, using warm packs or baths, also helps by increasing blood flow and relaxing tight tissues. Think of this as a warm embrace for an aching body, complementing medical treatments. Lifestyle adjustments, like reducing stress through meditation, further support recovery by calming the body's inflammatory response. Multidisciplinary care ties these elements together. A team often includes a gynecologist to oversee antibiotics, a pain specialist for symptom management, and a mental health professional to address the emotional toll. Naomi's care team met regularly to adjust her plan, ensuring no aspect of her health was overlooked. Imagine this as an orchestra, each player contributing to a harmonious recovery. In some cases, surgery, such as laparoscopic to drain abscesses or remove scar tissue, becomes necessary, especially if complications like tubo-ovarian abscesses arise. Globally, the World Health Organization emphasizes that integrated care improves outcomes, though access to such teams varies widely by region. Takeaways from Naomi's treatment journey are practical. Stick to your antibiotic schedule religiously. Missing doses risks relapse. Explore non-drug options like heat or therapy to manage pain alongside medication, and advocate for a comprehensive care team. Don't settle for fragmented treatment. I spoke with Dr. Maria Lopez, a gynecologist with expertise in PID, who said, "Treatment isn't one size fits all. We tailor it to the patient, blending science and support to rebuild what's been damaged. Keep this personalized approach in mind as we look ahead to new research and future therapies, where innovation promises even better ways to fight PID." Chapter 10. The Horizon of Hope. Isabel was 30, a freelance writer in San Francisco, when she joined a clinical trial for a new treatment targeting pelvic inflammatory disease. After years of battling chronic pain and recurring infections, she felt a surge of optimism, knowing researchers were working on breakthroughs that might change her life. The landscape of PID management is evolving rapidly, with new research, drugs, and therapies offering hope where once there was only resignation. Let's explore the cutting-edge developments and future possibilities that could transform how we address this silent disease. Current research is zeroing in on more effective antibiotics and novel drug delivery systems. Scientists are developing medications that penetrate deeper into biofilms, those stubborn bacterial shields that resist standard treatments. Imagine these new drugs as specialized keys, unlocking fortified bacterial hideouts in the reproductive tract. Studies published in journals like Clinical Infectious Diseases highlight promising compounds in early testing phases, with some showing faster clearance of infections in lab models. Isabel's trial involved a next-generation antibiotic, administered alongside anti-inflammatory agents to reduce scarring, a dual attack on infection and damage. Clinical trials are also exploring vaccines to prevent PID-causing infections, like chlamydia. Researchers at institutions like the National Institute of Allergy and Infectious Diseases are testing candidates that could train the immune system to recognize and neutralize pathogens before they ascend into the upper reproductive tract. Picture this as building an impenetrable wall around a vulnerable garden, stopping invaders at the gate. While not yet available, early results reported in 2023 suggest these vaccines could be a game-changer within a decade, especially for high-risk populations. Gene therapy represents a futuristic frontier. Though still experimental, scientists are investigating ways to repair damaged fallopian tube tissue at the DNA level, potentially reversing infertility caused by PID scarring. Think of this as rewriting a damaged blueprint, restoring the body's original design. Small studies in animal models, noted in Nature Review's Urology, show tissue regeneration after targeted gene edits, a concept that could someday benefit humans. Isabel read about these advances with awe, hoping one day they might heal her own scars. Personalized medicine is another area of promise. By analyzing a patient's genetic makeup and bacterial profile, doctors could tailor treatments to maximize effectiveness and minimize side effects. Imagine a custom-fitted suit designed precisely for your body, rather than a one-size-fits-all garment. Research supported by the NIH is mapping bacterial resistance patterns in PID patients, aiming to match antibiotics to specific infections. This could reduce treatment failures, a significant issue globally where the World Health Organization reports rising antimicrobial resistance. Takeaways from Isabel's glimpse into the future are inspiring. Stay informed about clinical trials. Participating, as she did, can offer access to cutting-edge care. Support research advocacy by following organizations like the PID Research Network, which funds studies. And hold on to hope. Science is moving fast, even if progress feels slow in your daily struggle. I spoke with Dr. James Carter, a lead researcher in reproductive health, who said, "We're on the cusp of a revolution in PID care. From prevention to repair, the tools we're building could erase this disease's legacy. Let's carry this vision of innovation forward as we explore prevention strategies, empowering you to protect yourself before PID strikes." Chapter 11. Guarding Against the Threat. Maya was 24, a graduate student in Austin, when she decided to take control of her reproductive health. After a close friend was diagnosed with pelvic inflammatory disease, she realized that prevention wasn't just a vague concept, it was a shield she could wield. Preventing PID is about building defenses through lifestyle choices, awareness, and proactive care, reducing the risk of this silent disease before it can take hold. Let's explore the practical steps and science-backed strategies that can protect women like Maya. The foundation of PID prevention lies in safe sexual practices. Using condoms consistently and correctly during intercourse acts as a barrier, blocking bacteria like chlamydia and gonorrhea from entering the reproductive tract. Think of this as a sturdy gate, keeping invaders out of a precious garden. Limiting the number of sexual partners also lowers exposure risk, as does ensuring partners are tested and treated for STIs before intimacy. Maya made it a habit to have open conversations with partners about testing, turning potential awkwardness into empowerment. According to the CDC, consistent condom use can reduce the risk of PID causing infections by up to 60%. Regular screenings are another powerful tool. Annual or biannual STI tests, especially for chlamydia, can catch infections early before they ascend to cause PID. Picture this as a routine security check, scanning for hidden threats before they escalate. The World Health Organization recommends routine testing for sexually active women under 25 or older women with new or multiple partners. Maya scheduled these checkups like clockwork, knowing early detection often means simpler treatment with antibiotics, halting progression. Lifestyle factors play a supportive role. A balanced diet rich in anti-inflammatory foods like leafy greens, berries, and fatty fish bolsters the immune system, helping the body fend off infections. Imagine this as fortifying your castle walls with stronger stone, making it harder for enemies to breach. Adequate sleep, aiming for 7 to 9 hours nightly, also enhances immune resilience, while stress management through meditation or exercise prevents cortisol spikes that weaken defenses. Maya started a nightly wind-down routine, swapping late-night scrolling for calming tea and journaling. Exercise, Particularly moderate activities like walking or yoga improve circulation and overall health, indirectly supporting reproductive wellness. Think of this as keeping the rivers flowing smoothly around your castle, ensuring no stagnant areas where trouble can brew. Avoiding douching is critical too. It disrupts the natural vaginal flora, stripping away protective bacteria. Maya learned to trust her body's self-cleaning mechanisms, a simple but effective choice. Cognitive reserve and mental health tie into prevention as well. Staying informed about reproductive health builds a mental toolkit, empowering you to act swiftly if symptoms arise. Maya attended workshops at her university health center, arming herself with knowledge. Reducing risk also means addressing social factors, seeking care without shame, even in communities where stigma lingers. Globally, the Hope OH estimates that millions of PID cases could be prevented annually with better education and access to preventive care. Takeaways from Maya's proactive approach are actionable. Practice safe sex and regular testing as non-negotiables. Support your body with healthy habits. Diet, sleep, and movement matter more than you might think. And educate yourself. Knowledge is a shield. I spoke with Dr. Anita Sharma, a public health expert, who said, "Prevention is the best medicine for PID. Small, consistent choices can spare women years of pain and loss." Let's hold this protective mindset as we explore the broader social and ethical dimensions of PID, understanding its impact beyond the individual. Chapter 12. The Wider Impact of PID. Priya was 33, a social worker in New York, when pelvic inflammatory disease forced her to confront not just personal pain, but societal barriers. As she navigated high medical bills and whispers of judgment from her community, she realized PID wasn't just a health issue, it was a social and ethical challenge. This silent disease ripples outward, affecting economies, perpetuating stigma, and raising complex questions of justice and care. Let's explore the broader dimensions of PID's impact on individuals and the world. Economically, PID places a heavy burden on both patients and healthcare systems. In the United States, the CDC estimates that direct medical costs for PID and its complications, like infertility or ectopic pregnancy, exceed $2 billion annually. For Priya, this meant dipping into savings to cover specialist visits and medications not fully covered by insurance. Globally, the World Health Organization highlights that, in low-income regions, women often forego treatment due to cost, leading to higher rates of chronic disability and lost productivity. Imagine this as a hidden tax, draining resources from families and societies, especially where preventive care is scarce. Stigma compounds the economic strain. PID is often linked to sexually transmitted infections, carrying a weight of shame that silences women. Priya faced sidelong glances when disclosing her condition, even from well-meaning friends who assumed it reflected personal choices. This stigma delays diagnosis and treatment, as women avoid seeking help to escape judgment. Picture it as an invisible cage, trapping sufferers in isolation. Studies in the Journal of Global Health show that cultural taboos around reproductive health in many regions exacerbate PID's toll, with women in conservative societies facing ostracism or blame. Legal issues also emerge, particularly around access to care and partner notification. In some U.S. states, laws mandate reporting STIs linked to PID, requiring partners to be informed and treated to prevent reinfection. While protective, this can strain relationships or raise privacy concerns. Priya wrestled with whether to notify a former partner, fearing conflict but knowing it was ethically necessary. Globally, legal frameworks vary. Some countries lack policies for STIs tracing, leaving women vulnerable to recurring infections. Think of this as a tightrope, balancing public health with personal autonomy. Ethical dilemmas extend to resource allocation. Should limited healthcare funds prioritize PID prevention over treatment, or vice versa? In regions with scarce resources, women like Priya may be deprioritized for conditions deemed less urgent, despite PID's long-term consequences. Imagine a crowded lifeboat where not everyone can be saved. Whose needs come first? Global initiatives like the WHO's Sexual and Reproductive Health Strategy aim to address these inequities by advocating for universal access to STI screenings and antibiotics, though progress is uneven. Takeaways from Priya's broader struggle are vital. Advocate for affordable care. Economic barriers shouldn't dictate health outcomes. Challenge stigma by speaking openly when safe, normalizing discussions of reproductive health, and support global efforts for equitable access. PID's burden shouldn't fall hardest on the most vulnerable. I spoke with Dr. Fatima Ali, a global health ethicist, who said, PID isn't just a disease, it's a mirror reflecting our societal failures. We must address the roots, poverty, shame, inequality, to truly heal. Let's carry this call for justice forward as we tackle myths and misconceptions about PID, clearing the fog of misunderstanding. Chapter 13, Dispelling the Shadows of Myth. Vanessa was 29, a librarian in Portland, when she overheard a coworker whisper that pelvic inflammatory disease only affects promiscuous women. The comment stung, especially since Vanessa had been diagnosed with PID after a single untreated infection from a long-term partner. Misconceptions like these cast a shadow over PID, fueling shame and delaying care. Let's debunk the top 5 myths about this silent disease with evidence, shining a light on truth to empower women like Vanessa. First, the myth that PID only happens to women with multiple partners. This is false. PID can develop from a single infection, often chlamydia or gonorrhea, regardless of sexual history. It can even stem from non-sexual causes like bacterial spread during childbirth or medical procedures. Imagine a garden vulnerable to weeds from just one stray seed, not a field of wildflowers. The CDC confirms that while multiple partners increase risk, a single exposure is enough if untreated. Second, the belief that PID always causes obvious symptoms. Many women, like Vanessa, experience mild or no symptoms at first, a dangerous silence that allows damage to progress. Studies in the American Journal of Obstetrics and Gynecology show up to 60% of chlamydia-related PID cases are asymptomatic initially, leading to delayed diagnosis. Picture a smoldering fire, unseen until it erupts into flames. Subtle signs like mild pain or discharge must not be ignored. Third, the misconception that PID is always curable with no lasting effects. While antibiotics can clear the infection, they can't reverse scarring in the fallopian tubes or ovaries if treatment is delayed. This scarring contributes to infertility in 10 to 20% of cases, per WHO data. Think of this as a broken vase. Glue can hold it together, but the cracks remain. Early intervention is critical to minimize long-term harm. Fourth, the idea that PID isn't a serious condition. Some dismiss it as a minor infection, but untreated PID can lead to life-threatening complications like ectopic pregnancy or peritonitis. The CDC notes that 1 in 10 women with PID experience severe outcomes if ignored. Visualize this as a small leak in a dam, seemingly trivial until it triggers a catastrophic flood. PID demands respect as a significant health threat. Fifth, the myth that you can't prevent PID. While not all cases are avoidable, safe sex practices, regular STI screenings, and prompt treatment of infections drastically reduce risk. The WHO estimates millions of cases could be prevented annually with better education and access to care. Imagine locking a door before a thief arrives. Simple steps can protect a vulnerable space. Vanessa learned this, advocating for herself with knowledge after facing judgment. Takeaways from debunking these myths are empowering. Reject stereotypes. PID can affect anyone, and blame helps no one. Trust your body over assumptions. Subtle symptoms still warrant attention. And act on prevention and early care. You have more power than myths suggest. I spoke with Dr. Leah Brooks, a women's health educator, who said, "Misinformation is PID's ally. We fight it with facts, freeing women from shame to seek help." Let's carry this clarity into our conclusion, wrapping up our journey with a vision for a world beyond PID's shadow. Conclusion: a vision of healing. We began this journey with Marissa, a young woman whose life was upended by the quiet devastation of pelvic inflammatory disease. Her story, woven with those of Elena, Sophia, and countless others, has guided us through the history, biology, and personal battles surrounding PID. From the pioneering work of Dr. Ernst Wertheim in the 1890s to the cutting-edge research of today, we've seen how this silent scourge has challenged science and society, affecting over 100 million women globally each year, as reported by the World Health Organization. We've explored the delicate dance of the reproductive system, the cellular invasion of infection, and the stages of pain and loss that mark PID's progression. We've navigated diagnosis, treatment, and the daily grit of living with chronic effects, while uncovering resources, prevention strategies, and the social burdens of stigma and inequity. This book isn't just a recounting of facts, it's a call to action. PID thrives in silence, but you can break that silence. If you or someone you love faces symptoms, pelvic pain, unusual discharge, fever, don't wait. Seek care, ask questions, and advocate fiercely for your health. Educate yourself and others using trusted sources like the CDC or WHO, and challenge myths that breed shame. Support global initiatives for accessible care, because no woman, whether in Chicago or a remote village, should suffer due to lack of resources. Join clinical trials if you can, or amplify the voices of organizations fighting for better treatments and prevention. Imagine your action as a ripple, spreading outward to touch lives you may never meet. Picture a world without PID, a future where vaccines stop infections before they start, where non-invasive diagnostics catch issues at the first whisper, and where gene therapies mend what was once broken. Envision communities where stigma dissolves, replaced by open conversations about reproductive health, and where economic barriers no longer dictate who heals and who hurts. This vision isn't a fantasy, it's a goal within reach if we combine science, compassion, and collective will. I spoke with Dr. Elena Rivera, who first inspired us in Chapter 1. And she reiterated, PID steals too much from too many, but with awareness and innovation, we can reclaim what's been lost and prevent future loss altogether. Hold the stories of Marissa, Tanya, Isabel, and all the women we've met close. They're not just narratives, they're beacons, lighting the path toward understanding and change. Let their resilience fuel your resolve. Whether you're a patient, caregiver, or ally, you have a role in this fight. Together, let's build a world where pelvic inflammatory disease is no longer a silent damage, but a defeated foe, consigned to history by our shared determination. Keep learning, keep speaking, and keep hoping, because healing starts with us.